Terrific. Okay. Hello, everyone, and thank you for taking the time to join today's webinar series. I'm Justin Walsh, and I head up marketing and brand development for our medical solutions portfolio. As you can see on the screen, this is part 5 of our Reimagining Care Delivery series. So we've provided an ebook that's attached to this webinar, which encompasses all 5 phases of reimagining care. We'd also suggest that if you've missed any of these prior webisodes and you'd like to watch them on demand, visit Henry Schein Solutions Hub, click webinars in the top right of the navigation menu. And in that section, we host our library of all prior of the webisodes that we've done. And then once you've watched those, feel free to call the phone number or fill out an intake form and speak with a specialist on any of those solutions that you're interested in. So today, again, is our 5th and final of the series, and we're going to be talking about scaling telemedicine with the all-encompassing Medpod platform. We have the pleasure of hosting Todd Stack, who's our GM of Telehealth Solutions. And Todd will walk through the presentation and talk about all the different phases of Medpod, Tele-diagnostics, software, hardware, data, clinical services. And while that's happening, that we would suggest there is a chat function. So if you have questions, please populate that area. And at the end of this webinar, we're going to do a live Q&A. So without further ado, I'm going to pass it over to Todd Stack, and we'll get this thing started. Thank you for joining.
Hey, great. Thank you, Justin. I really appreciate it, and thank you for joining the webinar series. As Justin mentioned, Medpod is a foundational component of the Henry Schein Solutions portfolio. I hope you find today's presentation informative and enlightening. Medpod is slightly different than what you might think of as telemedicine, and let's jump in here. So what I hope to accomplish today is, provide a high-level overview of current trends, both from a patient and provider perspective, an overview of the Medpod platform, its scalability, the value of telediagnostics, define what telediagnostics is and its capabilities, an overview of the Medpod RPM platform and its true turnkey services, and then lastly, answer any questions. I'd also ask if you would please contact your Henry Schein representative if you have any additional questions or would like to schedule a demo of any or all of the Medpod functionality we'll be discussing today. So virtual market trends. So, as noted, this is the most recent data by the advisory board. It shows the baseline for quote unquote telehealth visits was virtually 0 prior to COVID. And after peaking is leveled out at around 20% of total patient visits. Clearly, you can see consumers now see virtual care as a significant, if not primary, means to receive care. That's clearly a shift from just a few years ago. The data again shows that both consumers and providers are engaged in virtual care. That includes both primary and specialty care from both sides of the equation. I'd note that if I ask 10 different people their definition of telemedicine, I'd get 10 different answers. It really depends on their perspective and history. That helps frame up why Medpod is different than other telemedicine solutions. So what is Medpod? Medpod's a platform that's comprised of hardware, software, and services that allows providers and operators the means to change how and where they can provide high quality and in many cases reimbursable care. That includes control and capture of clinical data by a high-level provider remotely. That's billable for up to a level 5 E&M codes, along with remote patient monitoring for patient self-administered data, which is monitored by Medpod certified care coordinators. That level of engagement is critical if you want to ensure you're capturing data to meet the reimbursement criteria. Medpod has been deployed in a wide variety of care settings, from special needs group homes, schools, EMS, community paramedicine, to primary and specialty care practices across the country. So Medpod uniquely brings together hardware, software, clinical services, data to create a 360-degree virtual health experience. I mentioned before, if I ask 10 different people their definition of telemedicine, I get 10 different answers. When most people think of telemedicine, they think about a video visit. And a video visit is great. It's an absolute boon to be able to engage with patients, but it's limited in what it can do. We clearly offer video visits, but we go well beyond video visits into true professional devices and telediagnostics to capture data, clinical services, integration with other Henry Schein Solutions portfolio partners, data that can be aggregated and utilized to understand what's going on with your patient population, and of equal note, services to ensure that you don't have to hire additional staff to do a rollout of an RPM program. So why is Medpod different? Well, again, it's all about scalability. So from audio and video language translation services to video-only telemedicine, which I just mentioned, to Tele-diagnostics, which is a fairly new term, controlled by a remote provider, and remote patient monitoring, you can start anywhere you want with Medpod. You can do just translation services, just video visits, any combination of that, Tele-diagnostic for episodic care, remote patient monitoring for chronic care, or all of the above. Of equal importance, we don't operate a provider network. Our whole goal is to empower you as providers to take advantage of telemedicine, however you define that, and not just merely engage your patients with other providers remotely. It helps fight against attrition by some of the other telemedicine companies that you will know all too well. And there's no software to install and no license fees. Everything is cloud-based and meets all the security requirements for data protection. What does the entire platform look like? Well, here you go. So broad picture, video only shown in the upper left. So world-class video visits with waiting room functionality and branding specific to your practice. The mobile dock, the streamlined cart, and smart powered cart are part of our Tele-diagnostics portfolio. This again allows a remote provider to turn those devices on, off, capture audio, video, clinical data, annotate images, and push that into your EHR without having to rekey any data. Clearly, the mobile dock is meant to go to where the patient is, and I'll give examples of that later. And the streamlined cart and smart powered cart are for when patients are coming to your location. That location does not have to be a healthcare facility. It could be a school, a hotel, a prison, any place where healthcare is needed, and it gets deployed with a lower level on site. That lower level could be a tech or a telepresenter. So you can really leverage your most expensive asset, which are higher level providers. And then remote patient monitoring, which is patient self-administered, and I'll go into more details about the value of RPM in a couple of minutes. Clearly, live translation services are embedded across the entire platform. We also have a portable triage center, which is basically a portable 8x12 triage exam room that can plug into a 110 outlet or a generator and be moved and deployed anywhere you need it to be. Tele-diagnostics. So I mentioned in the agenda about talking about tele-diagnostics. So there are some other folks that do tele-diagnostics. None of them are focused in the ambulatory space. We're not making our own devices. We're using best-in-class devices, the same devices that are in your facilities today that you know and use every day. And those devices are connected to the Medpod software. You'll see in this example, the lower level provider in the upper left corner is engaged with the patient. The higher level provider in the lower left actually turned that video otoscope on, captured the inner ear image, annotated that image live on the screen, and that entire session and that image was pushed directly to that patient's record in your EHR or their EHR. So all the devices that you see on the screen, from vitals to concussion testing, spirometry, 12-lead EKG, bone density, etc., as well as lab devices, are connected to Medpod today and fully integrated. So if you buy Medpod without 12-lead EKG today and you add it next week, next month, next year, you plug it in and it shows up as a tool that can be utilized by remote providers, and there's nothing for them to install. They don't have to install CardioPerfect in order to run the 12-lead EKG remotely. System integration, critical, right? The whole point here is to make sure we're making life easier for you. So SmartLink Data Connector allows us to come in through the user interface and get the integration done much faster at a much lower cost than previously happens through traditional API and HL7 integrations. Integrated with over 70 EHRs currently, and that list continues to grow. Very simple and straightforward process. I'd like to show you a quick video on what that means.
Integrating Medpod into your EHR can be done in a matter of weeks with our rapid integration engine, SmartLink Data Connector. SDC utilizes the user interface of your EHR, so you don't even need to involve your EHR vendor. Here's how it works. You'll set up a username and password for SDC in your EHR. The SDC software will be configured to log into your EHR just like a remote user, pick up scheduled telehealth appointments, and add them into Medpod. After a telehealth visit has occurred, SDC will pick up all the information captured in Medpod during the visit and attach it to the patient record in your EHR. For more information about Medpod integration with your EHR, visit our website.
So I just want to comment on how different that is than traditional integration using APIs and HL7 that typically takes months and tens of thousands of dollars. This is a bi-directional connection that usually happens in less than 40 days for under $6,000. That allows us to pick up the scheduling live from your EHR along with patient demographic data. We capture all the clinical data as part of a Medpod encounter, and then all that data gets pushed into that patient's actual record in your EHR, and no one has to rekey any of the data. That's a really important component, obviously, and clearly allows for both awareness of what's happening with patients, but also billable events. We'll talk a little bit about remote patient monitoring and specifically Medpod remote patient monitoring. More broadly for RPM, reimbursement changes created an enormous opportunity for the deployment of RPM, both in 2019 and 2020. Clearly shows that better care, better outcomes, and reduced costs. Multiple studies have shown that for every dollar spent on RPM, the return on investment is 3 to 1, which is significant. We bring a complete turnkey solution that can be integrated with Medpod Tele-diagnostics for both episodic and chronic care, but our certified care coordinators ensure that patient engagement, data collection, and monitoring of your patients actually happens so you don't have to add staff and you can have a billable event. So again, it's a complete turnkey solution, pre-configured equipment, no out-of-pocket expense. We engage and train your patients. We perform the monitoring and alert you based upon your criteria, and you have a complete audit trail that then flows into your EHR so you can have a billable event.
Patient populations are growing as the number of working physicians declines. The pressure on the remaining physicians can easily lead to burnout. Work harder, earn less. Enter Medpod's remote patient monitoring solution. It's easy to get started and at potentially no cost to providers or patients. Step 1, identify which patients are good candidates for the RPM program. Step 2, develop an RPM patient plan. You can either create your own or use one of ours. Step 3, prescribe the proper kit in office or mailed to patients. Step 4, select the RPM service. Do it yourself and monitor patients with your staff via software, or use our turnkey solution, which offers a centralized monitoring center. Either way, patient data is measured, and the trending data will alert based on exceptions. Providers can then intervene when potential problems arise. The Medpod system allows for RPM data to flow into your EHR. Overall care costs are reduced by 34.5%. Hospitalizations are nearly cut in half, as well as the number of days patients spend in the hospital when they do need to be admitted. The 30-day readmission rate is reduced by 75%. Patient satisfaction is improved by 25%, and medication compliance is improved by 13%. Patient health outcomes are improved, and patient satisfaction increases. Earn more money and provide improved patient care with little to no extra work. Medpod RPM is available through Henry Schein Solutions Hub. To get started, visit henryscheinsolutionsHub.com or call Solutions Hub at.
So hopefully that video was worthwhile to have an overview of RPM and the value that it brings. As I mentioned, return on investment is 3 to 1, significant in that you're capturing data from patients on a daily basis. You're not pinged with alerts all day long. Our staff deals with that, and we set the appropriate thresholds and make sure your patients are trained so you can capture the data. I would say of equal importance is making sure that data flows into your EHR. So slightly different from how we do it with Tele-diagnostics, right? The patient's enrolled in RPM, it's documented in the EHR, we collect the data. As long as we meet the minimum criteria of 16 days of collection within the period, we trigger a billing event, we send an end of study report directly into that patient's record in your EHR so you know exactly what's happening. And then if there's any additional billing events for additional monitoring or services, those again happen directly through the integration of the RPM system and your EHR platform. And again, everything has an audit trail, so we know exactly how much time is spent on each one of the segments. So if you get audited by anyone, clearly by CPT code and the patient, we have the data of what exactly happen in that billing period. What does RPM look like? So on the top portion of the screen, you'll see the patient side of the equation. The upper left shows the health hub for Medpod RPM. Very simple, easy to use. The top right shows what an RPM kit looks like. So they get a tablet and the appropriate devices based upon what their chronic disease state or states are. I remind everyone that you only need a single chronic disease state to qualify for RPM. And then the software is going to guide the patients through on a daily basis. What do they need to do? What do they need to do next? Take their measurements, take their meds, take a survey based upon their results that happen or interaction that can be driven by us or by you. And then the ability to have a separate video visit that becomes a separate billable event. So if you need to engage the patients with a video visit directly from their RPM tablet, you can do that, or we can do that on your behalf. On the the provider side of the equation, the bottom portion of the screen shows the provider interface, all web-based, HIPAA compliant. You only see your patients. You'll only see, the information that you want to see. But clearly, when they've missed measurements or they're outside of range, you can drill down as deep as you want to go and see all data, 24 hours, 7 days, 14 days, every record, etc. Our goal is to make this as simple as possible for you to deploy. Hence why we do the monitoring for you. Ultimately, if you want to take on the monitoring and reduce expenses and capture more of the reimbursement dollars, you certainly can do that. We certainly would recommend that you start off with us doing the monitoring, which, by the way, are our employees, not outsourced to a third party to facilitate the successful deployment of your program. Quickly, here's the CPT codes for RPM. There's a one-time code of $21. These are the Medicare reimbursement fees. Just to note that private payers are reimbursing up to 3 times these numbers, and we can clearly review Medicaid payments on a state-by-state basis. Then the supply of devices and the transmission of data, the monitoring services, which come in 2 segments. The first segment, 99457. And then 99458 is for up to 2 additional 20-minute sessions to be captured for those patients that need a little extra time. What does all that mean? Anywhere from $123 to $209 per patient per month. Obviously, there's fees associated with the services we provide. And we'd be happy to have a conversation with you to talk about what net that looks like with the most hands-off approach, us providing the equipment and the monitoring services to your patients, training them, enabling them, and what that net result might look like. So thank you. That's an overview of the entire Medpod platform. Hopefully I've provided a little more information than you had before. Remember, it's a comprehensive platform that goes from language translation services, video visits, true telediagnostics, which can be built up to level 5 E&M codes, into remote patient monitoring, and then combinations of providing care for patients both from a chronic and episodic care basis. So if you have any additional questions, you can clearly go to the Henry Schein Solutions Hub and reference Medpod. All the webinars will be up on the Solutions Hub. And of equal importance, if you could reach out to your Henry Schein rep if you have any additional questions beyond this webinar, they'd be happy to engage and schedule a one-on-one demo where we can go into the details of what Medpod could mean for you and your practice. So with that, I'm going to turn it back over to Justin. If there's any questions, be happy to answer them.
Thanks, Todd. That was great. We have a few questions, and I do want to reiterate, to your point, you ask 10 different people about telemedicine, you get 10 different answers. In the resource center on our website, and you'll receive a follow-up email after the webinar. We've built out some original content that helps clearly define telemedicine. So there's different resources that we'll link you to in hopes that it'll bring value, the benefits of telehealth, how to implement telehealth, how reimbursement works. So we've created a bunch of content around these categories and topics. So that's going to be a follow-up email that we hope you can take value out of. A couple of questions, Todd. I'll start to read off the list. Can you talk about use cases? Where is this deployed and used currently?
Sure. So mostly, obviously, on the telediagnostic side, Medpod's a very robust platform, and we have some unique use cases. Clearly, in cross-special needs and group homes, we have a number of customers today that provide that on a very large scale. We were successful with the New York State Department of Health in saving millions of dollars from preventing folks in group homes that need care from ever leaving the group home, being transported by ambulance, and then being admitted to the hospital. And clearly be happy to share that case study data. And we're rapidly expanding in that space as well. Clearly in the employee health space, I would say many third-party employee health operators are utilizing Medpod to be able to provide on-site care for employees. School-based, our single largest customer is actually a practice that provides services to a number of school districts, have over 60 Medpod units deployed. And we actually have testimonials from and news feeds from several of these customers that saved, in the first year of operation when they weren't even at scale, over $500,000 for a single school district. That really made them step on the gas and expand the program 6x. Now they provide services to a number of schools. The school nurse acts as the telepresenter, and the medical practice provides the physician. And the success there and opportunity really is that allows them to generate an additional source of revenue as a practice. Our success there is not selling to schools directly. Our success there is selling to medical providers that bring the solution to the table and facilitate those services for the school. And then I'd also talk about emergency department avoidance across the spectrum. So whether it's primary care, specialty care, EMS, community paramedicine, we have numerous examples of providers preventing admissions, readmissions, and use of the emergency department. And in many cases, there's incentive-based contracts with payers that are significant. So not only they're not getting dinged with penalties for admissions or readmissions, they're actually receiving incentive payments to do that. And I'd also note, as there's a press release out there, I believe the parent company of Ambulance, or DocGo, put out a press release. They've selected Medpod as their Tele-diagnostic platform, and we will be expanding the DocGo Ambulance relationship significantly around the country for them to not only deploy Medpod in community-based paramedicine, but actually act as the transport and Medpod hands, if you will, on behalf of other providers. I'd love to have that conversation with any of our potential customers about the services they could provide.
Great. So community paramedicine, primary care, school-based, that was a huge savings for that district. Employee health, special needs. Second question, Todd, what about load balancing and the impact to staffing or per diems?
So I would say, clearly on the load balance fronts, again, we have several use cases in play because basically Medpod provides the opportunity for a provider to see a patient without physically being in that space. Now, the provider has to be licensed in the state where the patient is, and you have to have hands-on, but clearly you can use a lower level provider to engage that patient directly on site, if you will, with the remote provider coming in, controlling the devices, billing under their NPI number, billing a much higher level code. You don't have to hire additional per diems or additional contract positions. You can clearly utilize physicians on their off time and generate greater throughput for them and generate a new source of revenue while providing greater access to care.
Okay. We have EHR integration. How important is it, the fact that Medpod integrates, and I think you touched on SmartLink as software that helps expedite integration?
Yeah, so we think obviously it's a critical component. We're not there to replicate EHR, clearly. The whole goal is there's one source of truth, that's your EHR, but to create a bi-directional connection that allows us to capture your patient schedule live, basic patient demographics, validate that on the Medpod side, engage and have a clinical encounter, and then all the data that we collect as part of Medpod gets sent appropriately into the EHR for that patient, so no one has to rekey any of that information. The value of that is absolutely tremendous, and I think once in use and in practice, providers absolutely love the fact that they don't have multiple schedules. It flows within their normal workflow, and no one has to rekey any data. I also add, and I know I mentioned it in the presentation, that we do it through SmartLink. We do it typically in less than 40 days, which is unheard of. Traditional API and HL7 integrations usually take months, involve the host EHR, who makes it as difficult and as expensive as possible to make all that stuff happen. We've sidestepped all of that with the use of SmartLink and SDC and have lots and lots of customers that are very happy and be more than happy to engage any of our prospective customers with those already using the system.
Okay, so just to piggyback on what you talked about before regarding extending care, we have the question, so does that mean we can use an RN or LPN in the home with the patient when you're talking telepresenter?
Yeah, so actually you can use a telepresenter, which is actually lower than a tech, right? Their whole goal is to make sure that they're engaged with the patient. Clearly telepresenters can be certified, but it's a much lower labor expense. The utilization of Medpod, we typically can train folks in less than 2 hours on how to operate Medpod fairly simply. The real training really comes between the rapport and interaction between that on-site telepresenter and the remote provider, because those folks have to work as a team. If I'm your on-site engagement or telepresenter with your patient, I have to make sure I'm following your instructions and direction and can do all the basics of the exam as required to act as your hands, with the higher level provider clearly having oversight and actual control of the devices. But yes, actually we think that the labor component there is significant in reducing your costs and increasing your throughput.
And the last question, and we could possibly follow up with the asker. What was the company that provided or / acted as the mobile arm for transport and Medpod?
The company's name is Ambulance, AMBULNZ, and the parent company is DocGo, DOCGO, and I'll be happy to send the follow-up with a press release. So DocGo is actually working with several Medpod customers, and they're also utilizing Medpod as a service that they can bring turnkey to their customers to say, we can provide this level of service and engage and be your hands for the deployment of Medpod to your patient base.
And one more, Todd, just came in. Does the RPM patient need to be an established patient?
So I'm going to defer the answer to that. I know that only a single doc can sign up a patient for RPM. So once a patient's signed up for RPM, that's the only provider that can engage them. I'm going to have to defer to our team specific to if it can be a new patient or existing patient. I don't want to give any misinformation.
Gotcha. We could send a follow-up to those folks that asked that as well. All right, great. Well, that closes us out. There is a handout attached. I just want to remind everybody, so feel free to download the ebook for Reimagining Care Delivery, as this was part 5 of the big series. We are doing the Business of Medicine series, which is launching at the end of July. I'm sure you'll be communicated to for that, and that'll be another series that happens over the following couple of months. So Todd, thanks for joining us today, and everybody else, thanks for taking the time to learn about scaling.
Thanks, everyone. Appreciate your time. Have a great afternoon.